Jim, in the past you've had a number of root canals done, and then crowns put on, and then the teeth had further problems, and those were long, arduous procedures that we had to do root canals. We also had to cut your teeth down for crowns. Now, you don't particularly like having your teeth drilled on. You don't like to drill them, right?
Correct, yeah, I don't.
And that option is not one you would prefer, having had a mini dental implant done, and knowing the history of your teeth, you would select to have the tooth removed and have a mini implant and crown put in as an option to root canal therapy.
Yes, yes, I would. It's a much quicker and less painless procedure.
And it was quick for you, wasn't it?
Yes, it was very quick.
Your 2 appointments were separated just by a couple of weeks. You didn't have a great deal of discomfort associated with your implant placement.
Not at all, actually.
And you're pleased with your implant? And
very much pleased.
We're glad. I mean, would you recommend this procedure to others?
Oh, absolutely. Absolutely. In a second.
Okay, Jim, we're going to take a look at the kind of mini dental implant that you have, okay, and talk a little bit about how they work. This is a mini dental implant in the front. The option to this, to replace this missing tooth, would be to cut these 2 teeth down with a dental drill and make a bridge and cover all 3 teeth. That's the only other way we could really do it. Or put in a removable denture, which you definitely did not want. Okay, so what we did was have you in, made some models, sent them to the lab. A couple weeks later, the case came back. The implant was threaded in under light Novocaine, and the crown was cemented, and it was done and over with. And you did not have any problems with this procedure.
No, no problems at all. Went splendidly.
Splendidly. Didn't have a whole lot of discomfort to speak of, and you're pretty much able to eat anything you want.
Absolutely.
Is that right?
Yeah.
And you would prefer this as an option to root canals or bridges?
Yes, most definitely, yes.
Jim, as a patient here, you have had treatment with the dental laser for tooth decay, is that correct?
Yes, I have.
Do you know how this instrument works?
Not really. I know it doesn't hurt, but other than that.
Well, that's a good thing. Well, the water laser was originally developed for use in mining. It was miniaturized for use in dentistry, and the instrument contains a series of mirrors and a capacitor and a rotating mirror that makes the laser pop, and that's done in order that the laser does not damage or burn the teeth as it removes tooth decay. It sterilizes the area, and it affords us very precise control of decay removal, which is good for the patient because it becomes a minimally invasive procedure, and it is therefore less painful, and I believe you can attest to that.
Yes, absolutely.
The laser has never hurt you.
And less noisy as well.
And it's less noisy than a dental drill.
As well.
And this is a fantastic development for our patients. We not only use it for tooth decay, but we use it for people who have gum disease. And there's another laser in the other room which we use to diagnose tooth decay very early so that we can treat them small. One of the advantages to the laser is the comfort factor. Tooth decay or removal, most adults do not even need a Novocaine injection. For people who have gum problems, most gum problems can be addressed without having to have an open flap surgery with stitches and packing. And therefore the post-operative course of healing is much more comfortable and faster. But that's how our little laser works. Now that you've had your mini dental implant crown in for a while, how does it feel to you?
Like the original tooth. It was fabulous.
So you're not aware of it at all?
No, not at all.
You're able to eat anything you want?
So far, yeah. I haven't tried an apple yet, but I won't, actually.
But it's working for you now.
Fabulously, yeah.
Are you pleased with it?
Very pleased, absolutely.
Would you recommend this procedure to others?
Yes, I would, absolutely.